Let's talk about Pap smears. The purpose of the Pap smear is to screen for cervical cancer. What exactly is the cervix? Look at this here. This is your uterus. Remember the uterus? That's where babies grow and where our periods begin. But the very bottom of the uterus is the cervix, kind of like a light bulb. If the top of the light bulb is the uterus, the part that we're screening with the Pap smear is the bottom of the light bulb. The idea behind the Pap smear is that before the little baby cancer cell becomes a big bad cancer adult, we catch it. And we do that with the Pap smear. Now let's go back to my little diagram here. The cervix is all the way up here, but the opening to the vagina is all the way down there. So how could we possibly check out the cells up here if the opening is all the way down there? Now how are we able to see to the back of the vagina? We use these little instruments here called speculums. Now you've probably seen them before, and it's probably one of the things that's kept you from going to the gynecologist. But no, they come in all different sizes. So if you've had discomfort with the vaginal exam before or have had a history of vaginal trauma, ask your doctor if they'll use one of the smaller speculum first in order to see your cervix. One of the things that I do in order to prepare a patient for the exam is very gently place the speculum up against the labia so that you're accustomed to the feel of the metal there. Then very gently separate the labia and very, very slowly insert the speculum and turn it so that you can visualize the cervix. Now remember the beginning of this video when you could see my eye only when the speculum was open. This is how a Pap smear works. When we open the speculum, we're able to see the cervix at the back of the vagina. Typically, you're going to feel a little pressure at the top of the vagina and the bottom of the vagina when the speculum opens. When we open up the speculum and look at the very back, we look for something that looks like this, the cervix. It looks like a little donut. There's the outer part of the cervix and the very inner part, which is called the cervical os. These two little instruments here allow us to grab cells from the cervix to screen for cervical cancer. We have a spatula and an endo brush. First, we use the spatula. We very carefully place it against the cervical os, and then we very gently turn it around. As we're turning it around, we're actually picking up cells from the outside of the cervix. You saw a little of my glaze jump off? Cells will do the same, but they'll attach to the spatula. But the cells on the inside of that os are very important too. They could be bad actors as well. So what we use to get those is this little handy brush here. We actually place the brush inside of the os and turn it just a couple of times, again, to pick up some cells. We picked up some glaze there too. Now you see there's some cells on the edge of the spatula and some cells in the bristles of this brush. They are now taken to a special solution where the spatula is used to scrape the cells off the brush and the brush is used to knock those cells off the spatula. They're stirred around in this very special solution. We put a cap on it and then we send it off to the laboratory. From there we determine if we have healthy cells or cells that want to be little thugs and become cancer cells. You see, not so bad at all. You shouldn't start getting Pap smears until you're 21 years old. And then based on your risk factors, we determine if you get a Pap every year, every 3 years, or every 5 years. That's between you and your doctor who knows your history. But keep in mind, just like it takes time for a little baby to become a toddler, to become a tween, to go through puberty, and to become an adult, it can take that long for cervical cancer. When we get our Pap smears, we are able to identify those cells when they're little teeny toddler or baby stages, and we can keep them from moving on up to puberty and to become adult cancer cells. Check back in with me later while we talk about the different types of Pap results and what happens when that Pap result is anything other than normal. Stay tuned.